Boss.
SOS Doctor Part 2 begins on the national station of the CRTV, and this morning we are looking at the relationship between HIV-AIDS and violence against women. Our resource persons, Dr. Adidja Amani, who is a public health physician, and she is the Chief of Service in charge of Child Health Service at the Department of Family Health. And we also have Vivian Busu Ekole, who is a social worker. Vivian, before we went out, you were telling us about the kinds of violence that women who live with HIV-AIDS are exposed to. But before you continue, a quick reminder of our numbers. If you want to contribute to the program, you can send us a text message on 696804-148, 696804-148, or you give us a direct call. Apparently the numbers we usually use are not going through today, so please, if you have the numbers that are going through, you can just call us and tell us the numbers so that we communicate it to our audience. Vivian, can you tell us about the kinds of violence that these women are exposed to?
Thank you very much, Alice. Women who are infected with HIV and AIDS will go through physical violence. They'll go through battery, assault, torture. They'll go through sexual violence, that is sexual deprivation, that is denial of sex by the intimate partner.
What do you mean by that? Do you mean that if I or my husband is not infected and I am infected, he must still have intimate relationship with me?
Of course. Of course, when the woman is infected and the man is not infected, the sexual intercourse can still take place. I mean, we have HIV/AIDS units that counsel couples that are infected. So it is very, very possible. So at the moment the husband denies to have sex with the partner, it is refusal to have sex, and refusal to have sex is refusal to consummate the marriage, which was agreed on the day of signature of the marriage. The moment you legalize your marriage, your marriage, you have that obligation to consummate the marriage. And the moment you refuse to consummate the marriage, it's already a crime and it's a ground for divorce, and most women do not know that.
Is that? Don't you think it's easier said than done? Vivian, if you know that your husband has HIV/AIDS, would you accept to have sex with him? SOS Doctor, national station of the CRTV.
It is true that it is not easy. First of all, the other partner who is not infected has to go through the process of acceptance. You have to go through the process of acceptance. Mm-hmm. Your partner may have contracted the disease through some other means. It may not necessarily be through sexual contact with another partner. Mm-hmm. Because that's the first assumption. Mm-hmm. The first assumption is he has slept with another woman outside, and now he's infected, and now he's going to infect me. Mm-hmm. But now he may as well not have been infected by another partner outside.
Yes, we always think that, this woman has been unfaithful, and that is why she had it.
That is it. Mm-hmm. So the moment the other partner comes to accept the fact that this HIV/AIDS is a disease like any other disease, and so life goes on with the disease, it goes.
Okay.
It goes.
Let's hear from somebody writing to us from Bambili. He says, "Good morning, doctor. Please, I wish to find out if one can eat guinea pigs." Despite let me go back to the message. Okay, we shall be coming back to that message. It's just gone. Yes, if one can eat guinea pig despite the Ebola disease, I think we shall have another program for Ebola. Today we are talking about HIV/AIDS. It is not the same as Ebola. Maybe they are similar, but they are not the same. Let's take another caller. Hello.
Hello.
Yes, good morning.
Good morning, Alice, and the doctor in the studio.
Mm-hmm.
I'm G. Ignatius. I'm calling from Bamboo.
Nice to hear from you.
Yeah, I work in a hospital establishment, and at times I'm worried at the rate at which HIV is being spread. I also know that during antenatals, one of the routine tests for pregnant women is the HIV test.
Mm-hmm.
Yes, but I also have a worry why their husbands do not come for the very test. It is very important, though.
Mm-hmm.
So I wish to find out from the doctor whether she has that worry too, and what should be done to cause the husbands of these women, who are the people who are impregnating them, to come and do the test alongside the women.
Okay.
Thank you.
Yeah, what did you say your name was again?
Ignatius.
Okay, thank you, Ignatius. Yes, doctor. Husbands will not follow their wives to antenatal clinics for this test. Why do you think so, and what should be done to encourage them to come?
That's a real problem. In fact, you notice that men in general don't like to go to hospitals. So before the HIV test, we have what we call pre-counseling. You have to tell to the woman why is it important, and the ideal will always request her to come with the husband. But now, if the husband doesn't want to come, there's
nothing the woman can do, actually.
When we are in the community, we can use what we call community health workers, who knows the family, the house, and to go and sensitize the husband. But when you are in big town like Yaoundé or Douala, we have to pass through the woman. Or if you have like a phone number, we can call the husband, tell him why is it important that he should come here, because it's not just about his wife's health, but it's his health also, and the health of their children. But currently there's not a law that will
that you can do.
Yeah, there's nothing that we can do if he really doesn't want to come.
I think education also plays an important role. I know that as they are listening to us, they will understand the importance of knowing your serological status, because the legacy any parent would want to bequeath to a child is not HIV and AIDS. Yes, Vivian, we're talking about the different kinds of violence, and you were about this sex issue. It's a very delicate and sensitive issue. Marriages break because one partner is infected and the other is not infected. Is there an abuse of someone's rights here?
There is.
Yeah.
The moment you lay your hands on somebody, you are abusing that person's rights. The moment you insult somebody, you stigmatize the person, you discriminate upon the person, you are already abusing that person's rights. So I also want to draw the attention of the public here that most often women also contribute to this. To the violence. To this violence.
Against them.
Yes, against them. Why? Because when it comes to violence, most women wouldn't talk about it. Because they will fear the retributive effect. That is, if she talks about it, let's say she's married, she talks about it to the husband's sister, the husband's sister goes back to the husband to talk about it, they will batter her at home, and she will not talk about it. That's one reason. Secondly, she's depending on this man entirely for her livelihood. She doesn't have any economic power. And that is it. She wouldn't talk about this violence that is perpetrated on her. She has concern for her children. How do I start talking about this thing? This man sends me out of this house. What do I do? My children are there. They are still growing up. She is emotionally dependent on this man. Maybe she has lost her parents and she's an orphan. And her whole life, her whole
centers around this
man. How will she live? So, and many other things. She lacks support from her family and friends. She's hoping that, maybe this situation will turn around for better. There's this whole fear of social trauma.
So they just stay quiet.
And she stays quiet and she's depressed. She wouldn't talk about it.
Yes, there is another problem here. In our context, women don't have rights to inheritance. And many women, because they don't have rights to property and things, they are poor. Yeah. And if they get married, they don't have the economic power. And even if they knew or they know that their partners are likely to be infected because of their lifestyles, multiple sex partners, they cannot negotiate safe sex. Is that an issue? Is that a reason why women are more infected?
It is an issue. She doesn't have an economic power. She's not independent, so she cannot buy what she wants to buy. She can't buy the sex. But on the other, she can't pay for it, because if you have the economic power, you are paying for it. You pay a man who comes in and
even if you are married, you pay. You
get a man. You may not necessarily come to your house.
You tell us more about that. SOS Doctor, welcome to join us. Hello.
Yes. Good morning.
Yes. Good morning.
And good morning to your guest there.
Yes, good morning, Ernest Akufo.
Well, you're talking about violence against women infected with HIV-AIDS. I think the violence is not only physical violence as we've been talking about there, but I think the psychological, it's more worrying and more heavy than the physical even, because this aspect of stigma, when the husband already knows, maybe the wife is infected or what, you see, the lady in the studio, she was saying a few minutes ago, that when the woman is infected, at times the man refuses to go to bed with her. I don't. For a start, I think it's abuse of human rights. But in my place, I won't accept if I know my partner is infected, because despite the fact that you sign for better for worse, but I don't think when you see fire, you jump inside because you love your other house. I do think the best thing to do is trying to make the other partner leave with the condition for a long time, rather than having yourself, despite the lot of protection you can carry out, to be infected. Apart from that, I want to believe that women are themselves the problem. Why do I say so? You see, we're living in a very poor environment, and the women are very vulnerable. Yes, permit me say that. The women are vulnerable to the extent that, you see, some of them go in for just any type of men and at all costs. If you know, some women go to bed with men just because they've drunk a bottle of beer from them. So I want to believe it is the women themselves who contribute to their plight. So if they are educated, because go out on the 8th of March and see how these women, they think that the 8th of March is a day for them to do all sorts of atrocities, which I don't think is normal. So I think it's an issue of educating the women that they should know. And that women are a pearl, but they don't know that they are a pearl. Yes.
All right.
So I think education.
And that is what we are doing on this medium. Thank you very much, Ernest, for your contribution. But one thing I want to say is that love, when they say for better and for worse, it means that love should be unconditional, HIV positive or not. Yes. Vivian, you were telling us about this violence that these women will suffer because of their HIV status. Another one is that sometimes they are deprived of their sex. We were talking about their sexual rights, and now we talk about their reproductive health rights. There are times they go to the hospital, but because of their status, either they are discriminated upon or they are not attended to as they should be attended to. Is that true? Doctor, I can see you shaking your head.
I don't think so. I think
so. A woman told me that she went to the hospital because of her status, and she had to wait for too long, and she considered that, she linked that to her status. They were attending to other people, patients, and they were not attending to her. I don't know whether that is the same impression you have.
I wasn't there, but I don't believe that's the case, because I think health workers are already enough sensitized. They know what to do. They know which psychological support to bring, how to care for them. The truth is, when you come to see a specialist, any doctor,
there's a queue.
Yes, there's a queue, and you have to wait. But it's not because, I don't believe that it's because
of our status.
HIV is like, you can live a normal life with HIV as soon as you follow the treatment guidelines, the nutrition.
Are you telling us that if a woman who is HIV positive comes to deliver, the midwife will deliver her, without any comments, without any stigma, discrimination?
The midwife is not supposed to make any comment regarding to
her status.
The thing is that she would have a special delivery process, because you have to make sure that even if she was on antiretroviral treatment during her pregnancy, that will put everything in place so that the baby that will come out is not contaminated. So for that, especially, she will undergo a special procedure. That doesn't mean that is discrimination, but is that we are putting in place all the measures to ensure that the baby that will be born be HIV free.
Okay. Vivian, is there any other form of violence that these women go through which is peculiar to their situation?
Yeah, they would go through stigma. That is the most evident and the most prominent violence
against women
that can be perpetrated on a woman who is infected with HIV and AIDS. She will go through stigma.
Who stigmatizes them?
She will go through stigma from her family members, from her husband, from her sex partner in case she's not married, from the whole community. Yes. First of all, when you're a woman, you undergo stigma in the first place. In the African society, when you're a woman, you're first of all stigmatized. When you have HIV and AIDS or you have a disease that has a connotation with sex,
they think that is because you were promiscuous.
Yeah, that is it. So there is this stigma, and then there's discrimination.
And does this account for the fact, the stigma issue, for the fact that people are not still coming out to talk about their status because they fear to be stigmatized? For instance, we are looking for somebody who is living the situation to be part of this program, and we can't find. But they are there, they have support groups, but nobody wants to speak out. Is it because of the fact that stigma and discrimination are still very present?
Yes, Alice. First of all, when a woman is infected with HIV and AIDS, she is stigmatized and she goes through trauma. She goes through trauma, a lot of trauma.
Psychological trauma.
She loses her self-esteem because of the insults, because of the discrimination, because of maybe deprivation of liberty, and many other things. So she is depressed. And the moment you are depressed, you close up. And once you are closed up, it becomes very difficult for you to speak out, no matter what anybody can do.
Okay.
Now, when she meets the experts, she can now start, when she comes to the social service, she can now start talking because there's a way to go about it.
Yeah.
Confidential, yes, there's a way to go about it.
Okay.
So that is what makes women not to talk about it.
Tell us a little bit about their rights. Discriminating against them, is it an abuse of their human rights?
It is.
Yeah. What other forms of abuse of human rights that they go through? I know you're not talking here as a lawyer. The fact that women don't inherit property, is that an abuse of their rights?
It is.
Okay.
It is, because like every other human being, if a woman is considered like a normal human being, she's supposed to inherit.
Okay, let's hear from someone. Hello?
Hello?
Yes, please.
It's Ignatius again, Miss Alice.
Yeah?
Yeah, I got the doctor's explanation, but I was not very convinced that can keep men away from coming. I think that we need something like a legislation to force the men to come and do their tests alongside their wives or pregnant wives, so to reduce the stigmatization on those pregnant women too, as one of the social workers is saying. Because if not, if we leave it all to the women, you see that there will be much stigmatization on the pregnant women who come and do the clinic alone.
Okay.
So my suggestion is that there should be some legislation.
Okay. Yes, Vivian wants to react to that.
I also want to say that there exist HIV-AIDS units. I am not a medical expert, but at least I know that there exist HIV-AIDS units in hospitals around the country. And these HIV-AIDS units are there to take care of these cases, people who are infected and those who are affected by the HIV and AIDS virus. So they can come, they can go to these centers and get counseling and get proper consultation and get proper medical care.
Yes, but Ignatius is saying that in case a man doesn't want to come, there should be a law that forces that person to come. Hello?
The law is not yet in place.
Yes. Hello, Alice.
Yes. Very briefly,
from,
please.
What Ignatius is saying, there is a need to come out with a law on HIV and AIDS. And then secondly, from the research I've conducted, I've realized that the patient is herself or himself is really violent and non-associative to anybody who comes around him who is not positive. So there's a lot of work and a lot of chunk of money has to be given to social affairs to work on the psychology of the patient. Thank you very much.
All right. Thank you, Tony. In a short while, we shall be taking another break. When we come back from the break, you tell us about the psychosocial support that these women need. And the doctor will be telling us about how they can manage the condition and live a near normal life, if not a normal life. Our phone that's still ringing. Hello?
Yeah, good morning, police.
Yes, good morning.
This is teacher Elias from Commander.
Okay.
Yeah, I've just this I wish to know. A doctor happens to tell a carer's status, that is a doctor telling the carer about the patient's status. Is it a violation of the patient's right?
Okay. All right. We shall be answering your question, teacher, after the news. Don't go away.